The A.M.A. is today on an exercise to disinfect markets. Nancy M.F. joins us live from Agbogboloshi with some updates. Nancy, over to you.
Echo. Hello? I'm currently here at the Agbogbolo market, and for the people you see wearing the green and the somewhat blue are officials of NADMO, and today they are the team on the ground to undertake this disinfection. NACOP. Oh, NACOP and not NAPCO. Okay, yeah, NACOP. So they are here to partake in the disinfection exercise. Earlier I spoke to the public health director of the Accra Metropolitan Assembly, and she tells me that it is not the A.M.A. that's going to be handling the market, and that NACOP and also the military are going to be on the ground to ensure that the market is actually disinfected. Earlier when I came, I went through the market and realized that some of the market women have resorted to rather hawking, and so instead of having their stands on the tables and all of that, they're not doing any of that. They are actually using or carrying the things on their head and moving around with it because they know that it is going to be illegal for them to station their wares on the table. But I've been joined by the boss and the official here. I'll let him introduce himself because I don't want to quote him wrongly. Thank you, sir, for your time. What's your name?
Please, I'm Mr. Kwesinyako.
And you are the
team leader of the National Anti-Malaria Control Program.
Oh, no.
The short form is NAMCOP.
NAMCOP. Okay, so the National Anti-Malaria
Control Program.
Okay, great. Why are you here this morning?
This morning, we have heard something like name coronavirus.
Okay.
And that coronavirus we need to clean up, and after the cleanup, we have to do the disinfection so that it will help those around the area so that they will not get infected.
Okay.
That's why we are here.
Earlier, I've had people ask me a lot of questions. Yeah. They're asking me whether this disinfection is just to get rid of filth, the rattles, and other things, or you are specifically here to fight the viruses and the bacteria in the market.
Yes.
So which one is it?
We are here to fight the virus and the anti.
Okay.
Yes, that's why we are here.
Okay. So what chemicals are you going to be using?
Chemical number, okay. We are going to use alpha EC10 and what do we call? We will mix it with another vector back.
Okay.
Yes, so that everything will be okay for us.
Now, when I entered the market, let me just mention that one thing I realized was that the market women had left their wares on the table. So, for instance, those who are selling corn dough and cassava dough, you find that they've left them on the table. The tomato sellers have left them, except that they have covered them with rubber bags. Will you still spray or disinfect with the food stuff on the table?
Yes, we have already told them they should not come to the market today. This is have exercise patience for us to do the disinfestation. We see the Ghanaians, you know the Ghanaians, when you advise them, they don't pick it. That's why we have invited the military to come to our aid and force them to move from the market so that we do the disinfestation. That's why we brought the army to assist us. Yeah.
I get that. But the point I'm making is that they are not in the market. Some of them are not in the market. But their foodstuffs are still there. Will you be able to carry on this disinfection exercise even if the foodstuffs are on the table?
Normally, we will do it, but we have to cover it or find some place to remove it and station over there. After the disinfection, the owner will come for it so that he send it to the market.
How many hours are we expecting this exercise to last?
These hours are we look at the area that will show us the hours that we will do. You see Agbogboloshi market. Agbogboloshi market is big. We can use other 2 days, but we will try as much as possible to complete this work today.
Well, with my interaction with some of the traders, they tell me that if we take 2 days, they will die. And so they want you to give them this one day. Is there any assurance that they will return to the market tomorrow?
Yes, by all means, we assure them. That's why we brought the military to assist us so that we complete the work today.
Great.
So by all means, if God permit, today, yeah, everything will be okay.
I see that you guys are dressed beautifully with your helmet, with your nose masks, and I've not seen your gloves yet, but I'm sure that you are ready.
Yes,
Where are your equipment? Where are your equipment, by the way?
My equipment is here. Yeah, we have everything. Yes. So I have to.
Your spraying equipment are also where?
Yeah, it's in the bus.
Okay.
So from here, all the machines will come out. All the machines will come out, and the chemicals too, so that we start our work.
Are you going to give some of the helmets and the things to us? Because you also need them.
Actually, we have already said it already. So we have none. Okay. So we try as much as possible. Next time or the next month, when we are coming, we bring you some.
So we are starting as soon as possible.
As soon as possible.
Okay. I spoke to some of your colleagues, and one told me that he's coming from the eastern region. Where are you guys all coming from?
Yeah. Please, the question again.
I'm saying that I spoke to some of your colleagues, and they tell me that they are all not based in Accra.
Yeah.
Some of them are from other regions. Yes. Why are you assembling here in Accra?
Yes. You see, we have to invite all the workers, the NACOP workers, so that we stay at one place and divide us into two, so that all the markets and the area that we have to do the disinfestation will be completed. That's why we have joined the Greater Accra people, so that the disinfestation.
That's beautiful.
Okay.
So in order to fight the coronavirus here in the country, I want your people to come around. Let's clap for each other, because I see that you guys are going to do a very beautiful job. Please clap for yourselves. I know that this job they are going to do is not going to be easy. Some of them have left their home.
All right, so Nancy A.M.A. there, charging the team that's stationed at the Agbogboloshi market to do the fumigation. Somebody was asking, will this be carried out in the entire country? Well, the answer is yes, but we're doing it in bits. The exercise is beginning here in Accra. Some major markets shut down today. More than 3,000 Makola traders at the Makola 31st market have closed their shops today, for instance. So it's a countrywide exercise that is beginning in some parts of the Greater Accra region today. So A.M.A. and the greater parts of Accra. But Doc, the fumigation exercise, we had the chemical combination, and I wonder your understanding of exactly what we are fighting in the markets, and why is this exercise important?
The fumigation is important because we know the virus can survive on surfaces. So what it means is these fumigants are chemicals that will destroy the virus, but it doesn't leave a permanent effect on the surfaces. So what it means is after today, if they go to the market tomorrow and somebody leaves droplets on the table, they are not protected. So what I believe the A.M.A. should do is to provide disinfectants for these market women if possible, and then advise them to disinfect their surfaces as frequently as possible.
Okay. So this should be more daily, even frequently within a day, than a one-day shutdown and then, you know, disinfecting the whole area. Okay. And I was worried because Nancy said she had observed some women had left their foodstuffs and they're going to be spraying over them. I mean, what's the effect of that? Because if I left my agbelima on the table, even though it's covered, and this exercise will happen, I'll still come back on Tuesday and sell it.
That is dangerous because these chemicals are toxic. So if it is sprayed on food and then you consume it, it may affect you. So it shouldn't be encouraged.
So I guess destruction of whatever they find should be more like what they should do, because if you leave it sitting there like that and you go ahead and do your exercise, they will just come back on Tuesday and come and sell it to innocent people.
Yeah, they should behave like the Clean Ghana campaign team. If they go and then the conditions under which you are cooking is unsatisfactory, they seize and then they destroy the product. So that is the way to go. It's not safe to eat vegetables or foodstuff that have been contaminated with these fumigants. That's right.
Great. Okay, so you know,
the gentleman who called on the GC speed.
Yes.
Did you say vitamin E or C?
Vitamin C.
Vitamin C.
Yes.
Okay. Vitamin E actually, it's it's good for GCPD deficient patient. I had E.
Oh, okay.
I had E.
Okay.
Vitamin C, there is contradictory evidence to that effect. Some publication says if you take it in minimum dose, it wouldn't affect you. But if you take it in high dose, then it will trigger hemolysis, which is not good for the GCP deficient patient. So if it is vitamin C, controlled dose, but since you are not too sure which dose is controlled, then probably you stay away from that.
If you're using the tablets that you dissolve in water, is 1 a day, isn't it?
1 a day.
Okay. All right. So Theophilus, it is you we are talking about, because you mentioned that particular condition.
Yes.
Okay. So doc is telling you that
vitamin E is rather better for you.
Okay.
Yes. For vitamin C, they say controlled dose, but since our bodies react differently to certain things, maybe it may be safe not to take. So anybody who is GCPD deficient and is listening, that is it. Vitamin C may not be a good immune booster.
But vitamin E.
Vitamin E.
Okay. Can you get it in other foods? Can you get your vitamin E in other foods?
Yes, I mean there is vitamin E in quite a number of foods. But apart from even the vitamin C, there are other immune boosters that you can take to stay healthy.
Okay, this one says, my mom has been coughing and sneezing, plus she sometimes has difficulty in breathing and catarrh too, but these symptoms started in January and she had no history of travel whatsoever. Please, the doctor should kindly advise me on what to do. I'm scared.
Catarrh and sneezing.
And coughing.
Coughing.
Yeah.
And it has been ongoing since January.
January, yes.
What we know is this virus takes 14 days maximum. So if it were COVID-19, either she would have recovered by now or she would have been dead. But since she's coughing and sneezing, it's best she seeks medical advice. Go to a clinic nearby and then let them examine you properly. It may not be COVID-19, but it may be something that may also affect your health.
Okay. Kelvin Etonam is asking that if you contract the virus at an early stage, is it possible to cure it with home remedies?
I don't know of any home remedy available, but as I said, vitamin C is an immune booster. So even if you have the infection and you keep taking vitamin C, at least it will help you fight it off quickly.
Okay, so those who are in self-isolation, are they supposed to be taking something or just to be monitoring yourself?
They monitor them, and then self-isolation, that's self-quarantine, to see whether there's symptoms. Since you don't know whether you have it. But ideally, if you take immune boosters, so that in case you have contracted it, the outcome wouldn't be that severe.
Okay. All right. We have to wrap up on this. How are the hospitals looking like? We've got other diseases, other sicknesses. Are people visiting with other illnesses? Because our concentration has been on the coronavirus.
They're taking care of everybody, actually.
So if I have malaria, or I don't know what is wrong with me, but I feel ill, because we're being asked to stay away. You know, if you're not well, keep to yourself. Call the number. Am I just calling because of coronavirus, or I still can go to the hospital regularly like I used to if I wasn't feeling well?
It's not all hospitals that are attending to OPD cases. I think I'm not too sure if it was a total closure of OPD, but sometime last week also I heard something like that.
Yes, they did.
And then most theaters have also suspended elective surgeries. That is more of a social distancing thing, so that you don't overcrowd the place.
Okay.
And all those things. But if you need essential service, you have to go out, and health is one of them. You call the hotline when you are exhibiting any of those signs or symptoms of COVID-19. That is when you call the hotline. But if you have diarrhea and you want to seek medical attention, you don't call the hotline. You go to the hospital and then you'll be taken care of.
Okay. All right. Okay, so this is still, you know, a disease that we're battling with the world over. So we will definitely be coming to you for more education. But thank you. Unless there's anything that you want to say before we close.
So I just want to reiterate that we can actually halt the spread of this disease without doing much. Let's throw a 14-day challenge, maybe hashtag halt COVID-19 in 14 days. And let everybody pledge to practice these precautionary measures. And I'm going to start with that. So I, Paul Owusu-Oduro, I pledge to halt the spread of COVID-19 in 14 days. By so doing, I commit to practice proper hand hygiene. That is by washing my hands with soap and under running water and using hand-based sanitizers. I also commit to practice social distancing. I commit to practice cough and sneeze etiquette. And I also promise to call the hotline if I have any sign or symptom of COVID-19. Let's do this, and in 14 days, we should be able to halt the spread of COVID-19 in Ghana.
Thank you for showing the way. So let's see how he's thrown a challenge to all of us. Let's pick it up. This is something that we'll play back again. Thank you, Doc, for being here. Very grateful for the education. Thank you for your time as well. Now let's stay with this a bit because hundreds of soldiers have been deployed from A.M.A camp here in Accra to start nationwide disinfection exercise in an effort to halt the spread of the coronavirus. The exercise starts in the Greater Accra region today. It will be extended to other parts of the country. Head of our health desk, Fred Smith, attended the deployment, which took place in the early hours of today.
Here at A.M.A camp, where hundreds of soldiers are being deployed to our markets, starting from Greater Accra region, to try and disinfect those markets and ensure that we halt the spread of the coronavirus disease in our country. So far, 24 persons have been infected and 1 person has already died out of this, and the government is leaving no stone unturned. They're trying to undertake this exercise to ensure that they bring the situation under control. So also behind me, another set of personnel drawn from Zoom Lion to try and support the military officers who will be on the ground to disinfect our markets across Ghana. It starts this morning in Greater Accra region.
I am Brigadier General Nsia, the General Officer commanding the Southern Command of the Ghana Army.
Thank you very much. Can you tell us why you've brought so many military men here today?
The soldiers are here because we have to rise up to the occasion when our services are required by this country of ours.
What is the occasion, sir?
The occasion is for a nationwide fumigation exercise to disinfect our markets, and we are commencing with Greater Accra region. So this morning, we marshaled the forces that we have in partnership with a Zoom Lion group of companies to undertake this important exercise within the Greater Accra region.
How many men are you putting out on this?
We are close to 500 soldiers. Close to 500 soldiers.
I see. And what exactly would they be doing on the field?
A lot of duties. First of all, the gang that are doing the disinfestation and spraying, they will need close protection. So we have soldiers detailed specifically to protect them. Secondly, we know that once the market is closed, some miscreants may take advantage of the situation to break into the markets. So we have soldiers also patrolling the market to ward off any would-be criminal who may want to take advantage of the situation. Apart from that, we have other soldiers who are strategically deployed at certain locations to monitor what is happening and give us feedback so that if there's any need to reinforce, we do it. So this is basically what we are going to do to make sure that first, the fumigation exercise goes on smoothly, and secondly, nobody take undue advantage of the situation to break into the markets to cause any criminality and break the heart of people who have put their wares in the market and they are obeying the instruction to vacate the market for the market to be fumigated. We want to assure them that nothing of this will be stolen by anybody. We are going to ensure tight security for the market.
And if you have any message for your hundreds of men you are deploying and the nation at large?
The soldiers, they should remember that the whole country is behind them. This is a very important national exercise, and we are not going to let ourselves down. The whole country is looking up to us, and we are going to deliver to assure our Ghanaians that the trust that they put in us is not misplaced. What is left is the execution. And I know by your hard work and dedication and professionalism, you are not going to lose your gas and let yourself down. Go out there and behave professionally the way we have briefed you and the way we expect of you. We shall be with you in the field. We shall visit you at every corner that you find yourself. Remember, you are not working alone. You belong to a proud army. You belong to a proud organization. Your leaders are with you. Your sole leaders are with you. The whole nation is behind you. Go and do a professional job and bring pride to yourselves and our army and our armed force. Everything has been arranged. There's nothing to worry about. I wish you well, and we shall be with you in the field. May the good Lord be with all of you. Thank you very much.